Are you ready to talk about something that could cost you thousands of dollars in retirement if you aren't paying attention? I want you to listen to me, and I want you to listen closely. Medicare is not free. Every single day, I hear from people just like you, hardworking people who are about to retire, or who are already retired, and they say, Susie, I worked for 40 years, I paid my taxes, so my Medicare is free, right? Wrong. And that misunderstanding is a financial disaster waiting to happen. Today, we are going to look under the hood of Medicare Part A. This is your hospital insurance. This is what covers you if you are admitted to a hospital room, a skilled nursing facility, or if you need hospice care. And yes, while it is true that you probably do not pay a monthly premium for Part A, that does not mean it is free. Do you hear me? First, let's address why most of you don't pay a premium. If you or your spouse worked and paid Medicare taxes for at least 10 years, what the government calls 40 quarters, then your monthly premium for Part A is $0. You paid for it during your working years. If you didn't hit that 10-year mark, you could be looking at a premium of up to $565 every single month in 2026. Think about that. That is over $6,700 a year just for the privilege of having the coverage. If you get sick and you have to go into the hospital in 2026, you are hit immediately with a Part A deductible of $1,736. Let me repeat that number, $1,736. You have to pay that amount out of your own pocket before Medicare pays one single penny for your hospital stay. And here is the absolute kicker that trips up almost everyone, so please, write this down. The Medicare Part A deductible is not an annual deductible. It is not like your auto insurance or your homeowner's insurance where you pay it once a year and you're done. No! The Part A deductible is per benefit period. What is a benefit period? It starts the day you are admitted to the hospital, and it ends when you have been out of the hospital or a skilled nursing facility for 60 consecutive days. Imagine this scenario, it's January. You get pneumonia, and you are hospitalized for 3 days. You pay your $1,736 deductible. You go home, you get better. Then in April, more than 60 days later, you slip on the ice, break your hip, and you're admitted to the hospital again. Guess what? Your previous benefit period is over. You are in a brand new benefit period, which means you must pay another $1,736 deductible. You could easily end up paying that deductible 2, 3, or 4 times in a single year if you have multiple hospital stays spaced out. That is over $5,000 or $6,000 of your hard-earned retirement savings gone in the blink of an eye. Are you prepared for that? But it gets worse. Let's say you have a really serious illness or a major surgery, and you have to stay in the hospital for a long time. For the first 60 days of your stay, that $1,736 deductible covers you. That is an extra $13,020. Your total bill is now over $14,700. And if you are in there past 90 days? You start dipping into what Medicare calls your lifetime reserve days. You only get 60 of these days in your entire lifetime. And in 2026, the copay for those reserve days is a whopping $868 per day. If you run through those 60 lifetime reserve days, you pay 100% of the costs. Every single cent. This is the fear. The fear of being wiped out financially by a health crisis when you are on a fixed income. It is a very real, very justified fear. Because medical bills are the #1 cause of bankruptcy in the United States. And when you are 70 or 75, you do not have the time or the energy to go back to work to rebuild a shattered nest egg.so. What is the question you need to be asking yourself right now? The question is, how do I protect my retirement savings from these massive, unpredictable out-of-pocket Medicare costs? You do not just sit there and hope you won't get sick. Hope is not a financial plan. You must take action, and you must do it before you enroll or during your designated enrollment windows. You have 2 main pathways to protect yourself, and I want you to look at both very carefully. Pathway number 1, original Medicare paired with a Medigap policy, also known as a Medicare supplement insurance plan. If you choose to stay on original Medicare, Parts A and B, you can buy a private Medigap plan. These plans are specifically designed to step in and pay those high Part A deductibles and hospital daily copays for you. If you have a Medigap Plan G, for example, it covers 100% of your Part A hospital deductible and copays. Yes, you will pay a monthly premium to the private insurance company for this Medigap policy, but it buys you absolute peace of mind. You will know exactly what your healthcare costs are going to be month after month, with no nasty $1,700 surprises. Pathway number 2, a Medicare Advantage plan, also known as Medicare Part C. These are all-in-one alternative plans run by private insurance companies approved by Medicare. They bundle your Part A, Part B, and usually your Part D drug coverage together. The benefit here is that many of these plans have very low or even $0 monthly premiums, and they have an annual out-of-pocket maximum limit. Once you hit that limit, the plan pays 100% of your covered services for the rest of the year. But the downside is you must stay within their network of doctors and hospitals, and you may need prior authorizations for certain procedures. Your immediate, actionable takeaway today is to go to Medicare.gov or sit down with a trusted, independent Medicare broker, someone who does not just represent one single insurance company, but who can show you all your options. Look at your health history. Look at your savings. If you have a healthy nest egg and you want total freedom to see any doctor in the country who accepts Medicare, look seriously at Original Medicare plus a Medigap plan. If your budget is tighter and you don't mind staying within a network, compare Medicare Advantage plans. Do not wait until you are being admitted to the emergency room to figure this out. The choices you make when you first sign up for Medicare will impact your financial security for the rest of your life. You work too hard, you save too disciplined, and you sacrifice too much to let an unexpected $1,736 hospital deductible repeatedly chip away at your retirement. Take control of your healthcare. Take control of your money. Because nobody is going to care about your money more than you do.